on these days. Predict to these patients that your full moon, your cough or your pains will disappear in the morning at 10 a.m. on full moon day and the new moon day or the new moon day. Right? This is what? The video theory. Video theory, you have seen that, temperaments. Yes, these are the acute strategies. And your question, arthritis. Yes? Hypertension is fourth layer disease, arthritis is third layer disease. As everyone knows this. Yes, if the disease is arthritis inflammation of the bones and joints and cartilages are reduced, and the hypertension will start coming over. The inflammation is the, what is that? Inflammation of this arthritis is sora on structural plane. Hypertension is a functional. Okay? So what is that? How to understand this? If the disease which is on ectoderm because of some constraint which has been pushed directly from ectoderm to neuroectoderm. Yes? Ectoderm to neuroectoderm. Neuroectoderm in the sense brain, meningitis, what we call it. Yes? When measles are being suppressed, meningitis. Acute disease which is being pushed directly onto the acute stage of the brain, mind. Yes? Now the disease is somewhere in endoderm, gastritis. This is most probably, this is soric, this is also soric. Gastritis, which is psychotic. Asthma, which is also psychotic. Chronic urinary tract infections. Yes. Leukorrhea. These are all psychotic. What happens here? If the disease is here, it should, if any constraint, emotional constraint or the physical constraint which may push this disease directly onto the endocrines. Second to fifth, endoderm to endocrines. Ecto to neuroecto. Ecto to ecto, endo to endo. Yes? Endoderm to endoderm. Right? So what is this here? Asthma. A person who is continuously suffering with asthma may have hypothyroidism. A person who is constantly suffering with gastritis may have diabetes. A person who is suffering with frequent urinary tract infections or any other problems pertaining to the sexual system or the urinary system will have the ovarian or testicular dysfunctions, which are endocrines. Yes? Do you accept this? A person who is having strictures. Yes? What happens next? How to identify this? Whether the person is the stricture of any part, esophagus, stricture of urethra. Yes? Stricture which is jumping from the lower level, that is endoderm. Okay? Endoderm to the endocrines. How to identify that? Now a person who was having stricture esophagus, what is happening here? Excess production of elastin is visible. Right? Excess production of elastin is visible. And only for that reason, the stricture happened here. And if the stricture is gone, and now the patient starts suffering with dark pigmentation on the face, dark pigmentation around the neck. Yes, dark pigmentation on the corners of the elbows and axilla. What is this? Melanin. Yes, Melanin. So in pars medialis you have got elastin, fibrin. This is your pituitary, anterior and posterior pituitary, which is been connected to hypothalamus. What is here? This is pars medialis, where elastin, fibrin and melanocytes are. Okay? If the disease which is traveling from elastin to melanocytes is suppression. Which is taking the help of fibrin to give this deposition of plaque, or else leukoderma, where fibrin is being pushed to the periphery, elastin is being released completely, and the destruction of melanocytes started taking place. This is also suppression. Right? So, endoderm to endocrines. Different parts. Asthma. Where is your thyroid gland? In front of trachea. When the tracheal cells proliferate, will give rise a thyroid gland. When proliferation of the intestines proliferate, which gives pancreas. So intestines पहले आए, pancreas बाद में आया, trachea पहला आया, इसके बाद thyroid gland आया. Yes. So this is the interlinking connection. Now, if the disease is somewhere in rheumatism, bones, joints, muscles and cartilages, or somewhere in diabetes, okay, which is being pushed onto a higher level to the mesodermal organs. Rheumatism, rheumatoid heart disease. Yes. Dermis infections which causes COX. Lichen planus is tubercular infection of the which may jump directly onto the lungs.
Lichen planus is not tubercular infection.
This is what we call is the lichen planus or psoriasis. What we take it as a tubercular infections.
No, they are not tubercular.
These are definitely these are not the mycobacterium tuberculosis is not affecting, but the disease nomenclature name is been given as a tubercular disease.
No, lichen planus is considered to be an absolute autoimmune disorder.
That's what autoimmune disorder. Psoriasis is also autoimmune disorder.
Then why tubercular?
This is what only the tubercular infections. What we call them. The destructive disorders are otherwise tubercular.
You mean to say miasm or tuberculosis?
It's not tubercular miasm, sir. Sorry. You just read the medicine book again. Read the medicine book again, which is there.
Very clearly mentioned.
Okay?
No,
that's what. And only because of reason. Because this is what? Where if this is being suppressed, if psoriasis is being suppressed, may have the lung infections. Yes? Lichen planus is being suppressed, which goes directly onto the lungs, giving rise to tuberculosis. Yes? This is how. So, the area from where the disease from third to fourth. Right? This is now is being connected. If this circle is being connected like this, your arthritis which was structural here has given a functional change over here. Okay? Structural psora is dangerous than functional psora.
But
progression of layer, that is a progression of layer.
This is what I know.